Talk about the coronavirus. COVID-19 case numbers are rising once again in Maryland, and the MVA is dealing with it too, with more than 20 employees testing positive. So now their union is demanding action for safety. WMAR 2 News' Abby Isaacs explains what they want to see happen.
AFSCME wants increased transparency, a deep cleaning of all facilities, and reduced capacity to minimize the spread of COVID-19. But the Maryland Department of Transportation Motor Vehicles Administration says they're doing what's necessary to keep people safe.
The conditions that we work in are horrifying.
With an increase in COVID cases in MVA employees, some are afraid to go into work.
It's a lot of anger, it's a lot of frustration, it's fear.
Kim Henson is one of them. She says she contracted COVID while working at the Glen Burnie branch. There have been at least 21 cases reported to the union within just the last 2 weeks, including 10 at the MVA facility in Glen Burnie and another 5 in Baltimore City. And one state employee from the Largo facility died. AFSCME held a virtual press conference today demanding action to stop outbreaks and ensure public safety.
We want proper, safe measures put in place.
AFSCME is asking Governor Larry Hogan and MDOT take immediate action to shut down and disinfect MVA facilities using a licensed cleaning company.
I don't believe it is a legitimate cleaning crew whereby they would wear the proper gear and sanitize the way that the MVA should be sanitized.
And when they reopen, return operation to 50% capacity. They also want increased transparency about the outbreaks. Henson said she found out about the potential exposure through another employee instead of management.
It's just a lot of hush-hush. I'm not asking for any names to be divulged, but I certainly would want to know that there are others around me who have been sick with COVID.
The MDOT MVA said in a statement they perform daily cleanings and deep cleans when a case is suspected or confirmed. The MVA also said they post notifications of COVID-19 cases in accessible working areas like break rooms to alert employees. Henson says this is not the working environment she knows, and she does not want to go back to work when her 2-week quarantine is up.
I haven't been released to go back to work, but what about when I do go back? How do I know that I'm not going to get infected again?
The MVA says safety precautions, including plexiglass dividers, temperature screenings, and appointment requirements, will stay in place until further notice. For WMAR 2 News, I'm Abby Isaacs.